Hello, this is Nathan Morello, and this is my communication presentation for week 7. This is the communication presentation for the class Interprofessional Communication and Collaboration for Improving Healthcare Outcomes with teacher Marissa T. My communication presentation is based on nursing health and proper ergonomics. I chose this topic because as a chiropractor, I've been teaching people proper body mechanics for many years. And now that I've switched careers into nursing, I've noticed that a lot of proper body mechanics aren't being used when nurses are lifting patients up in the bed, when nurses are sitting charting, when nurses are standing charting, when nurses are bent over putting in IVs or injections, and also cleaning up the room. I've seen a lot of just bending over. And I believe that nursing health and proper ergonomics is the key to have a long career in nursing without injuring yourself. According to research, nurses most commonly suffer from low back pain. In the research article, when they surveyed nurses, 52% of nurses said that they most commonly have low back pain. And that is followed by overexhaustion. So 38% of nurses, when surveyed, said that they had exhaustion was their second complaint, only to low back pain. This makes sense because most actions in nursing involve using your core to lift patients up. And those patients that you're lifting up are usually in really awkward positions, or they're just dead weight. And we all know that that dead weight feels like 3 times heavier than a person that's not dead weight. In regards to overexhaustion, just too many hours, too many lack of breaks, lack of days off in a row, and all the other things that come with nurses being exhausted all over this country. In the same research article, the third most common injury for nurses were sore necks. And usually this comes from charting and looking down at medication labels. But I believe it's really mostly charting. The standing charting desks are really good for your low back, but a lot of times they're too low for actually putting in soap notes and for charting and for putting in prescriptions and checking on vitals. So you're standing, but then you're looking down to look at the screen. Also, the charting areas or wherever the nurses are together at when they're doing their charting aren't specifically ergonomically designed for each nurse. It's generally just a countertop with a bunch of laptops or a countertop with a bunch of PCs, and all the chairs and all are at different levels and different makes and models. And then the countertop is one height. And so when you have nurses from very short to very tall, that there's no way that one common area can accommodate everyone. As I said before, when charting using a standing bedside station, that's great for your low back, but not so great for your neck. But if we could have specific ergonomically set up workstations for when nurses are sitting, that would seriously reduce neck injuries and upper back injuries. And most commonly also is carpal tunnel syndrome in nurses. And you would think that would be from drawing blood or putting in IVs. or doing something more dexterous, but in actuality, it's usually from typing and mousing. According to Kitagawa 2020, they did research on nurses trying to figure out what was the best ergonomic positions for lifting patients up higher in bed. And they put sensors on nurses' low backs, and they tested how the muscles in their low back would fire and react based on foot position. And what they found was that when a nurse was at the bedside and the foot closest to the head of the patient was facing parallel to the bed, and that the back foot was facing perpendicular, this gave the nurses the least amount of tension in their low back as they were lifting the patient up higher in bed. Before going to nursing school, I used to be a physical therapy assistant at St. Mary's Hospital in San Francisco, and I had to do a lot of lifting out of wheelchairs, a lot of lifting out of the chair in the hospital bed, in order to get the patients over the physical therapy part. And so we routinely use the gait belts. I don't know why nurses don't use gait belts, why they pretty much leave the physical therapist to do that, but a gait belt is a great way not to hurt your back. We basically bring it around the patient's waist, get it on there nice and snug, and that gives you a handle in order to help lift that patient up out of the wheelchair or out of the chair to get him into bed. It's very difficult to lift a patient up by their armpits, and it's very difficult to and somewhat dangerous to not have that gait belt on them because of slip and falls for the patient and for the nurse. And so the best advice is to put that gait belt around the person's waist, get it on there nice and snug, bend down, make sure the brakes are on the wheelchair, squat down to eye level, and then on the count of 3, you and the patient come up with you holding onto the gait belt. And then you both pivot to get that patient's butt onto the bed, and that's a really good safe lift. In regards to exhaustion, research has found that proper sleep, proper nutrition, meditation, counseling, and frequent vacations can help. We're not inventing the wheel on how to take care of yourself. It just seems that nurses tend to sacrifice themselves more than a lot of other professions, and have a hard time taking care of themselves, even though they don't have any problem taking care of everyone else. And I'd love to see more nurses, having a daily practice of yoga, a daily practice of meditation, and bringing proper food to work, so that they don't go hours without eating. My resources here are small, but I can assure you that they've all been used in this presentation. Thank you so much for listening to me, and have a great night.